Care coordination is making the healthcare system work for the family and for the child's needs within the family. It's not a new concept. It's something that has common sense as the common denominator, but it also is greatly impacted by the world of healthcare and how that is so rapidly changing around families, within the families. So care coordination is the function of getting the right care to the right person at the right time. And now we add that, which an important indicator, which was there all the time, but not so much spoken about, which is at the right cost. I also would add to that, as a nurse and a pediatric nurse practitioner, it is having the right person involved in the care at the right time. That may be a physician, a nurse. It may be a nutrition expert. It may be the early education teacher, physical therapist, occupational therapist. It may be the chaplain, and it's always the parents. So parents are the care coordinators for their families. And in the adult world, I coordinate my own care. I make decisions and make choices of available options. I do that in choosing whether my family joins a health club or we go to the park on a daily basis. So it's looking globally at well-being and using the systems and the resources available to us. Now that doesn't answer the question for a health professional or for a professional organization of, what are we talking about when we talk about care coordination, or to talk to the legislators on a health policy basis. I would say it is finding the gaps in what people need versus what they have, and then making decisions based on the family's needs and priorities. If I went to work every morning and said, I'm a care coordinator, what would I do? I would probably be making assessments on a daily, hourly basis. Who needs what now? What can I do to problem solve for this family, for this child? Maybe it's an immediate visit that they need to have an acute care problem solved. Maybe it is getting the right sized wheelchair, or putting them on the free lunch program or the early breakfast school program. So it is a marvelous way to do your work. It's foundational to the nursing profession, to social workers. It's how they would describe what they do in many settings. And it's also crosses other professions as what makes our day feel like it was meaningful. It's when we coordinate care, we make it happen, and we deliver a solution to a problem. It's very rewarding.